Greetings, everyone. My name is Adele Caruso, President of the Pennsylvania Coalition of Nurse Practitioners. I am also a licensed and practicing nurse practitioner in Philadelphia, PA. I would like to take a few minutes to thank each of you for your dedication, hard work, and passion for our profession, as well as to share some PCNP updates. For the past month, we have been in an unprecedented and uncharted time in our country. Each of us has had the responsibility to do our part, and I am so very proud of everything PCNP members are doing, including those on the front lines, working tirelessly to help protect the citizens of the Commonwealth. Nurse practitioners make a difference and play a critical role in healthcare, and even more so during this COVID-19 pandemic. PCNP immediately developed a COVID-19 newsletter, and you were asked to share your experiences and challenges. I would like to thank everyone who provided us with feedback. The common themes revolved around licensure and prescriptive authority changes. This enabled us to collaborate with the Board of Nursing to work through the challenges. The Board of Nursing did a wonderful job of working with us, and particularly given how quickly all of this transpired. I would also like to acknowledge Governor Tom Wolf and Dr. Rachel Levin for working with the Board of Nursing. PCNP recognizes that the Board of Nursing worked within the given guidelines to allow nurse practitioners more flexibility to practice during this pandemic. At PCNP, we have been hard at work to move our legislation. Although we haven't made it over the finish line yet, we have made some significant progress this year. We continue to work with our lobbying team to strategize our plan and to educate our legislators. So where are we? Our legislation is with the chair of the Professional Licensure Committee, Representative Hickernell. Prior to COVID-19, we were scheduled to meet with Representative Hickernell. However, due to the stay-at-home order, our meeting was delayed. Be assured that once the Capitol is open again, we will be ready. So what can you do? Please follow our e-communications and our social media outlets. This will allow you to participate in our legislative efforts. Thank you for everything that you do and everything that you have done. Please stay strong. You are needed now. I would like to share some experiences of two of our members, along with Senator Bartolotta and Representative Topper, both of whom are strong champions of our profession.
Hello, I'm State Senator Camera Bartolotta, and I just want to give a heartfelt thank you to all of our nurse practitioners across the entire Commonwealth of Pennsylvania. You're putting yourselves on the front lines every single day. You are sacrificing health and welfare for that of others. And I just want to thank you for that. I want to thank you for your expertise, your talent, your education, and your compassion. And because of people just like you, we're going to make it through this. And on behalf of a grateful Commonwealth, please stay well, stay healthy, and thank you for everything you do.
I'd like to take this opportunity to thank our nurse practitioners for their work and their continued work during this time of crisis. You're an excellent example to all of our healthcare professionals. Your work and dedication each and every day truly highlights why we need to continue to work to get you full practice authority here in the Commonwealth of Pennsylvania. Thank you for all that you do.
Hi, my name is Lois Chappell. I'm a nurse practitioner practicing in long-term care during the COVID-19 pandemic of 2020. Caring for a very vulnerable population during this time has been both an honor and a privilege. We've never seen anything like this in long-term care. And for nurse practitioners to be at the bedside to diagnose and treat and monitor COVID-19 infections and all the complications that our long-term care patients can succumb to has been nothing like I've ever experienced in my life. It's been an honor, really, to be able to connect them, the patients, with their families, and to be able to support the nursing home staff through educating them about the virus and the prevention, and also to provide telephonic care of these patients, and telemedicine for our nursing home patients when they need it most.
Hi, I'm Don Bucher. I'm an acute care nurse practitioner, and I was asked to share a little bit about my experience with COVID-19 and acute care. I think, like everyone, I've gone through the gamut of emotions when it comes to treating patients with COVID-19, from the fear of not having enough PPE and bringing this home to my family, to concern over the multiple changing protocols that we have. Has been a challenge, definitely. I think the biggest thing I wanted to share is that I really feel that there's been a increase in teamwork, and we're all in it together, and there's less of who's doing what and more of how are we going to get through this together. And I think that's the most important thing, is we work as a team, and we're there for each other. And if you're starting to feel overwhelmed or depressed, or feelings of that you can't do this anymore, make sure you reach out to someone. That's why we're all here. Reach out to a friend, a colleague, a peer. Try to make sure that you're not in alone. Make sure you reach out to someone and share your feelings. We're all in it together. We'll get through this, and I think in acute care, we're definitely in it for the big fight in the long haul. So thank you very much.
PCNP will continue to fight the fight for our members. Thank you for serving during the COVID-19 pandemic, and thank you for all you do for our profession.